we'll have our compare factor section. This will give you the drills, the bolts and nuts to drill down into your patient population. So for example, in this screenshot right here, this is looking at your baseline score. Baseline scores, of course, if you have a high baseline score, if you're starting at an 80 CUS junior, there's no way to really achieve that 20-point improvement. It's just not possible. So what this does is it gives you the ability to see what percentage of your patients, what is their pre-op score, and the percentage of patients that have that pre-op score, do they achieve SCB? So of course, when you're in that 30-40 range, the majority of patients within your organization, as well as the network, achieve SCB. The higher pre-op scores, most of them do not. And then the lower scores, when you're in the 0 to 10, like they've got some extreme disability to start, so it's kind of not necessarily, but we do see a higher percentage. Interestingly, with one of my alpha partners of DataPRO, what we did is we actually drilled down into the patients that had a 90 and above of a HUS or CUS. We started with joints and pulled out their op notes and their clinic notes from Athena, which is their EHR. We sat down and took a look at, this was the clinic note before surgery. This is what their CUS junior score was before surgery. These are high CUS junior scores that are indicating great levels of function already, low levels of pain, good quality of life. Comparing those operative notes as well as the clinic notes, we de-identified that data and put it in front of the surgeons and said, hey, what made you determine that you actually wanted to provide surgery on this patient? And it was very interesting to see what the surgeons had to say, but ultimately I think it was a lesson for the surgeons that they really want to start leveraging the PROMs preoperatively and start to determine, is this the right candidate for surgery to achieve that substantial clinical benefit?